Okay. Okay. Good day, everyone, and thank you for joining us today on our weekly Facebook Live presentation. Okay. Good day, everyone, and thank you for joining us today on our weekly Facebook Live. I'm sorry about that. I will just start again. My phone apparently it went on loud, so I will take it off. All right. Okay, let me start again. Good day, everyone, and thank you again for joining us on our weekly Facebook Live presentations. Today, we are doing part 2 of common problems in small ruminants, and I hope that it will help a lot of you out there, farmers, veterinarians who are looking on, and anybody who has an interest in animal and animal diseases. I just want to say that part 1, or common problems in small ruminants, the first one that we did is currently on YouTube, as well as it's on the ministry's Facebook page under videos. Today, I will be focusing on 2 common problems that I see in my county and in other counties as well. We're going to deal with prolapse as well as pink eye. I must say, though, that some of the pictures may not look too pretty and some people may be offended, but in the interest of the farmers who may see this in their farm, sometimes you really have to put the real picture for them to understand what it looks like. Okay, and these are actual cases that I would have seen. So let me start. The first picture you see there is what you call a prolapse. And if you look closely at it, you would see an eversion or a pouching out of a tissue at the rear of the animal. And this is what we call a vaginal prolapse. So you will ask, well, what exactly is an animal prolapse, or what is a prolapse? This really refers to the abnormal positioning of an organ from its normal anatomical position, right? There are different types. One of them, the common ones we see, is the vaginal prolapse, and it can occur when the ewe pushes her vagina out of the vulva, as you would have seen in the picture before. Vaginal prolapses can occur with or without the cervix being involved, so that's part of the reproductive tract of the animal. A vaginal prolapse can look like a smooth red mass, like the size of a tennis ball, and it could vary in size to the size of a lemon, or even like a orange to then a melon, right? So this is the sizes that you may see. I'm going to show you a little picture in a while again, so you can have an idea of what it looks like. All right. So there are different types of prolapses, as I said before. There's the vaginal prolapse, there's the uterine prolapse, there's cervical prolapse, and of course there's the rectal prolapse. Most ewes, and I'm talking about sheep or goats at this point, tend to prolapse in the last month of pregnancy, or the last trimester, which is the last 1/3 of the pregnancy. Just keep in mind 150, 155 days. I had said that originally in the first presentation. So if you're looking at the last month of pregnancy, you have an idea what we're looking at. The early signs of prolapse could look like the early stages of labor, and the farmer may not be sure. But one of the things you could see is the animal kind of stay away from the others. They isolate themselves from the others. They may be forcing, or they may show, or straining, as the term is, or abdominal pressing. So you're seeing them kind of forcing as though they want to urinate, but nothing really coming out, but you're seeing this mass coming out. And sometimes they make a lot of noise. They bleat, or they make noises that, you know, it's a sound of discomfort. So it is something that you need to be concerned about. Well, one of the things you will ask is, well, what is cause of a prolapse? What causes a prolapse? Well, there are a few reasons why prolapses can happen, and they're caused by low calcium levels in the blood. If the animal has a poor diet, for example, if they use a high fiber diet, in some parts of the world, in the Caribbean, sheep sometimes, or goats will eat root crops, and that's high in fiber. So that could be one of the causes. The presence of multiple fetuses or multiple lambs or kids. The fact that the sheep is carrying, like for example, Barbados Blackbelly, they tend to carry 2 to 4 lambs. The fact that they have a lot of fetuses, that can cause prolapse, because of the amount of lambs in there, and it causes a strain on the animal. excessive rumen distension or excessive forces during difficult birthing, excessive forcing, during difficult birthing. So that could happen. Exposure to estrogens, and estrogens are hormones that are present especially around pregnancy time. So if there is the animal exposed to that, or in certain feeds or certain grasses, not feeds, grasses, that is also a cause. An animal that is obese, obesity, some animals tend to be a little more obese than others, and that is also a common cause of prolapses. Some animals are genetically disposed to this particular problem, and sometimes animals that are lame, and sometimes we have farmers with animals and they unable to trim the hoofs, or they don't know how to do it properly, and if an animal is lame, they can't walk properly, so they tend to lie down a lot, and in lying down a lot, you may get a predisposition for this prolapse. That's why I say lameness, especially if the animal remains recumbent. Recumbent means you're lying a lot for a long period of time. Okay. So I apologize for the pictures. They're a bit dirty, but it's best that you can do these circumstances. It is what it is when you take the picture. So you will see on the picture, you'll see a black a goat. She is you're seeing by the tail there's some feces, but you're also seeing a protrusion. In this case, you're seeing two protrusions in the two pictures, right? And the other one, you see, it's more everted. So the picture is you notice the prolapse, the pink tissue is rather dirty. An animal is and if you look to the top of the picture, in both of them, you will see a rectal prolapse happening. So we tend to see sometimes when you're having a vaginal prolapse, you may also see a rectal prolapse because of the excessive straining and forcing, all right? As I said earlier, that vaginal prolapses occur in the last trimester of pregnancy. The animal, as you would imagine, would be in increased discomfort because there's this stuff coming out at the end there. And of course, there will be irritation and swelling of the everted tissue, that is the tissue that's coming out. The animal will continue to strain and the prolapse may move in and out. And we call that intermittent prolapse because it may move in and out. So it's a tiny, small, like the size of, say, a tennis ball or orange. You may see it coming, and especially when the animal lies down, you will see the prolapse coming out, and then when she stands up, it goes in. So that's what you call an intermittent prolapse. But then it could progress. If left untreated and it starts to get bigger in size or increasing in size, and it may become contaminated with feces and dirt because they will lie down if they're defecating, or, you might get feces falling on it. If they lie down in the dirt, if they have if they're in a pen with dirt or any kind of soil, they will get the prolapse itself dirty, and it can become contaminated and get infected as well. Sometimes, if it is not treated, the entire vagina may become prolapsed, and the cervix, which is part of the reproductive tract, will become involved. And sometimes when this happens, usually by this time it's much larger, the bladder may move into the prolapsed vagina. And if it's not treated timely, you could have severe consequences, right? Because what happens is the bladder may become full with urine, and it becomes enlarged, and that will hinder the correction of the vaginal prolapse. So what you'd have to do, or the vet would have to do, is ensure that the bladder is drained to be able to fix the prolapse. Because if this is not done and not done properly, the bladder can become ruptured, if the bladder is not drained timely, right? So moving on, I want to talk a little bit, that is the vaginal prolapse, and the cervix, as I said before, can become involved. This is another type of prolapse, and this is called a uterine prolapse. And if you look at the picture there, you're seeing some little stuff that look like, it's actually called caruncles, but they look like buttons, and then you see the pinkish tissue. So this is where the entire uterus comes out, all right? And a uterine prolapse can occur shortly after lambing. especially when you have a large single lamb, because that lamb is big and forcing, you get the entire thing everting, right? It could also occur within 12 to 48 hours post-lambing, and this is caused usually by straining after they've given birth, or from pain and or infection. The uterus is identified by the size and also the presence of the caruncles, which I just spoke about, the button-like structures, and also there's sometimes fetal membranes wrapped up in there, and that's how you know it's a uterine prolapse. And this type of prolapse, you definitely need to call a veterinarian when you see this, okay? Because it has to be dealt with very quickly. Rectal prolapse, and I showed you earlier the two pictures where there were two pictures, and both of them you were seeing the rectum prolapsing. Now, this happens usually when rectal tissue protrudes outside the anus. During prolapse of the vagina, it can be seen as a bright red tissue protruding outside the anus when the female is straining. And if you look at the picture there, people, you would see how dirty the vaginal prolapse is. You're seeing outside a mess there. You see the tail with some dried feces, and we were trying to like cut off it. That is the feces that is stuck to the tail, because we have to clean the area and all of that before we fix it. But if you leave the rectal prolapse untreated, it can become dry, it can become cracked, it can even become bloody, and it must be treated quickly. And in Trinidad, we have a lot of what we call the screwworm flies. So they would come and they would land on those exposed tissues, and the next thing you have myositis or screwworm maggots, as some people call them, right? So if you have this problem, a rectal prolapse, as well as a vaginal prolapse, you definitely will need to call a vet. And this is something that you need to treat as soon as possible. Okay, so you ask, well, how do we deal with this? How do we manage our prolapse? So as we said, there were different types. So the vaginal prolapses must be replaced as soon as possible to prevent further trauma or bruising in the vagina as it remains outside. If it remains outside too long, the blood flow can be reduced and the tissues can die. And normally if that happens, the whole tissue looks black or purple in color, and the tissue becomes very friable. It's fragile and it will burst easily. So what you would want to do is the vet could wash the area with warm water and antiseptic. We use brown sugar, because when it gets really swollen, what the brown sugar does is that it allows the process of osmosis to take place. So it causes the tissue to shrink so that it could be put back in, because if it's very large, it has to be manipulated to put back in. You can also use lubricant. There are some advocates that they rather use the lubricant rather than the sugar, because they feel that the sugar could cause bacterial infection. However, if you're using the sugar, you can, once the tissues are reduced, you can wash it off. And you could use the lubricant. So you use that to reduce the size of the prolapse, and then you reinsert it using the flat of the hand or the fist. So, like you knead it and you kind of push it in gently, so you put back in the prolapse. Now, as I said earlier, the bladder can become full, and so if the bladder is full, you may want to lift the prolapse towards the tail to help relieve the bladder. Now, I have had farmers in the past teach them this particular to help out, because if you leave the animal there with the entire tissue outside and it gets dirty, as I said, you can get infection. So we recommend that at least you wash it with some warm water and some antiseptic, like Savlon, right? And you keep it clean, right? And you can put the sugar, call your vet, and they will come and help you reinsert it. Okay, I have had farmers actually reinsert it themselves using the sugar, having it reduced to the size where they can take it and put it back inside. But if you are able to do that or afraid to do so, you could call your vet and they will come and assist you. Now, sometimes if it's really, really big, it will take a while to do, and you may need surgical intervention. So you call the county vet, or the county vet will come and do is it'll give you an epidural anesthetic And so that will cause some relief during the surgery or the manipulation to put it back inside. And then what we do is we use a suture material, and we suture it, or we use special types of we use a local anesthetic, sorry. And the sutures are done and they're applied to prevent the organ from prolapsing again. Generally, what we use is a suture called a Brunner suture, or there's purse string type sutures. The vets will normally use that. But the sutures assist and prevent the organ or the prolapse from coming back. The other thing we recommend to farmers is that to keep the hind legs elevated, so that the animal, in terms of forcing, there will be less of a pressure to push it back out. So that's one of the things that we recommend. But please, if you do have a problem like that, at least try to keep the prolapse area clean and call us as soon as you can. Another way that you could deal with this is something called a prolapse harness. Now, this is something, it's sold on Amazon and a lot of the sites that sell animal products, livestock products, sorry. This is what you call, it is used to retain the prolapses without resorting to the stitching. So there's something, it's like an animal husbandry technique that they use in other countries to do it. If you look at the sheep, this is a sheep and he's facing forward. You look towards the rear area, you'll see there's the harness. It goes around the rear legs, and that piece there towards the anus and the vulva, it comes over and it remains there so that it keeps the prolapse in place. Of course, you would have had to put it in first and then put it. And I would recommend this for like really small prolapses, sorry. So it is designed to apply pressure around the vulva and prevent the prolapse from recurring. And what is good about this is that you could loosen it or remove it around the time of lambing to allow the lambs to be born. And that is one approach to dealing with prolapses, especially small vaginal prolapses. Then there's something called a prolapse spoon. This is not my picture. I just want to say I got this off the internet because I didn't have any that I could take, but I wanted to show you what it looks like. Once the prolapse has been reinserted, you take this prolapse spoon, right? You notice how it's shaped like a T, and there's a string at both ends. So you would put a lot of lube on it, or any type of lubricant, KY jelly, that kind of thing, and you smear it on the spoon, and then you insert it in the vulva. Notice the part that is inserted in the vulva is the longitudinal shaped, sort of oval shaped part of it. So that goes inside, and then you attach it, you tie the ends to a piece of rope or to a harness, all right, so that it remains and it keeps the prolapse inside. Now, in countries where there are a lot of woolly type animals, they would recommend that you could tie it to the wool. But then sometimes if the wool comes off, then it's no use. So I would say use the harness, or use a piece of rope to keep it in place, and so it will stay. Right. So this is another approach that you would need to use sutures if you use this prolapse spoon. So there are two different approaches for not using the prolapse harness and the prolapse spoon, that you may not need to use stitching. But I would recommend these more for the smaller type prolapses. Okay, so treatment. Of course, you recognize that the animal, depending on the time the vet gets to the farm or how long the prolapse has been out, if you don't treat it timely, you could get complications. You could get rupture of the vaginal wall. You could get peritonitis. If the vet comes and puts it back inside or reinserts it, usually they'll put the animal on some antibiotics, because the animal, the length of time, and if of course, most likely it would be dirty or it would be inflamed, you'll give some anti-inflammatory or pain meds will be given by the vet to allow treatment to make the animal better again. So you would want to treat it timely. Now, if the animal is pregnant, this is important. And I always tell my farmers, the sutures must be removed before lambing or kidding. Now, in the case of the, let's go back a bit here. In the case of the prolapse harness, the harness is such that the lambs could could come out. Also the prolapse spoon, you could loosen it. But with sutures, if you use the suture pattern, you will need to be able, as soon as you see the animal starts giving birth, and that one of the signs will be you started to see fluid coming out, you would want to cut that suture so that the lambs can be, or the kids can come out. Otherwise, they will not be, they may have problems or difficulty in birthing. So another thing that we recommend is that because this vaginal prolapses can occur in other pregnancies or another pregnancy, these animals who have had prolapses should not be kept for further breeding, because it will happen again and you will have a problem if your animal gets a prolapse again, and sometimes you may lose the kid or you may lose the mother. So once this is sorted out and the animal has been, the prolapse has been fixed, we recommend that you do not use this animal further for breeding. All right? And that's a wrap on prolapses. I also want to talk about something called pink eye, and we see this fairly often, particularly in the rainy season. And we are in the rainy season, so I thought that perhaps this would be something that you all would be interested in. Now, those pictures there, if you look at the eyes of the animal with the white color, you would notice a thickened, mucopurulent looking discharge from the corner of the eye. And the other one, it might be so clear, but the eyes are almost covered. So what exactly is this, you may ask? This is pink eye. Pink eye is a term that is used to describe any number of diseases affecting farm animals, and farm animals with the eyes. It's also called keratoconjunctivitis, which is an inflammation of the cornea and the conjunctiva. It is also called contagious ophthalmia, and it is caused by a number of things such as bacteria. So it can be caused by chlamydia or mycoplasma, and also in cattle there is a particular organism called Moraxella bovis, which is spread by flies, and as a bacteria it is spread by flies. And animals, when they're feeding, sometimes if the area in which they're feeding are dirty, it can get, the flies come and they rest on their eyes, and that is how the bacteria is transmitted, or the chlamydia or the mycoplasma. So usually it happens also when they're feeding in the same trough. So you have a communal pen and the animals are feeding in the trough. Flies will obviously help spread the disease, because if one animal has it and it goes and feeds in a trough with the others, the fly could spread it from one animal to the other. They fly to another area in the pen, and that's how they will get it. If you have dry, dusty conditions, it does worsen the disease. If the feed is very dry and fine, you can get, when the animal's moving up and down on the trough, that's how you will get it as well. If the animals are overcrowded and they have poor ventilation, that will increase the incidence of this problem, pink eye. And it's not very nice to see. It doesn't really look really nice. I hope you can see it a little better here. This is the same animal, but at different angles. And this animal also has another problem, but it started off as pink eye. And you can see all along the eyes and along there's tearing, because obviously it's painful, so the animal will have a lot of tearing along the eyes, and sometimes it becomes so bad that the eyes themselves close. Right? So it's a condition that could affect one eye or can affect both eyes. Animals will blink a lot and they don't want to look at the sunlight. I don't want to say it's the same thing as red eye, but if you think of yourself or anybody you know have red eye, how painful it is, and you keep getting tearing and you can't look at the sunlight, so it's similar. It's not the same, but it's similar. It shows the tearing, and the side of the face is often wet. Animal can partially close the affected eye because of the discomfort. And when it becomes really bad, like we saw in the first picture with the white sheep with the kind of mucopurulent discharge along the side, sometimes it sticks on the eyelids, and also the hair, and it becomes you could have the whole eye closing off because of the thick type of pus that sticks up, and then you would not be able to, the animal not be able to open its eye properly. If you look at the eyes themselves, you will notice that the membranes of the eyes appear red or inflamed, or sometimes becomes very cloudy. And in very advanced cases, you can get ulceration of the eye surface. So that's something you need to deal with very quickly, because it can spread to the entire herd, or if you just have 3 or 4 animals, all of them can get it. Sometimes you can get temporary blindness, and if it's not treated timely, the animal could get permanently blind. All right, so this is a particular problem that you want to deal with as soon as you can. So how do you manage it? Well, obviously, if you see an animal with a problem like that, one of the things you need to do is isolate the sick animal from the rest of the flock to prevent spread, right? We normally would recommend terramycin ointment. I'm going to just say here you need a prescription for that. Or there are other antibiotic eye ointments that can be applied 2 to 4 times a day. If you are a farmer who would normally use mastitis ointment, if you can't get the terramycin ointment, you can use the mastitis ointment because the composition is similar, and it will help heal the eye infection. Also, antibiotic eye drops are available. Again, you would need a prescription for that. Healing can take from 1 to 4 weeks, and if it is that it's taking pretty long to heal, your vet may want to consider giving the injection in the conjunctiva. But that is something that only a vet should do, because you don't want to be trying to do this on your own. So usually between 1 to 4 weeks, it heals up and the eye becomes better once it's treated on time. Right. So how do you prevent this? One of the things you'd want to do is isolate the affected animals, as I said before. Obviously, you'd want to control flies. I know it's difficult to control flies in the rainy season, but it's something you have to do once you have this problem. You need to control flies, reduce the irritation by dust, and obviously, if this happens where there's a lot of sunlight, you want to keep the animals away from sunlight if it's infected. That is, if the animals are, say, out in the, say, the pasture, and they have this problem, you would probably want to bring them inside, because you don't want to have them exposed to the sunlight, because it will worsen the problem, right? And basically, this is one of the problems that we see pretty often. And I thought that those 2 problems you would want to see and hear about, so you can either contact your vet or try to deal with it very quickly. I put up on the screen here our veterinary services, the county veterinarians, and these are the offices, and they are located in St. George, Waterfield, St. Andrew, St. David, Caroni, Victoria, Rio Claro, St. Patrick, and of course our senior vet in Montreal. So these are the numbers that you can call for help depending on the area in which you are. Okay, so feel free to let us know if you're having a problem of any kind, or if you're having these particular problems that I have identified. I just want to say that as I come to the end of the presentation, that should you have any questions, we will be taking the questions now, and that I hope that what we have been doing, animal production and health, what we have been doing in trying to educate you is helpful for you all, and that you can look forward to many more presentations from my colleagues and myself. And if there are any questions now, I will take it. Thank you. Presentation. Okay, we give them a little while, because sometimes people will ask a little bit after. Right. Okay, somebody asked me about trimming the hooves, Mr. Joel Manahar. Okay, I believe we have a presentation on that, but if there's something that you need to, if you tell me what area you're from, we can speak to the vet in that area, and so we can give you advice. or perhaps if there are any, if somebody would like to, we could rerun the trimming of hooves, so that could be something I'd want to do again. We haven't done it in a while. I'm told that it was done some time ago. So it's difficult to explain how to do it. It's something that you really need to see a video on how to trim it. Anything else, Karanish? That's it? All right, then. Right, so that's it. No, not this particular pink eye, no. It can spread to other animals. It is not a zoonotic disease. Yeah. I just mentioned red eye because the symptoms are kind of similar, but the organism that spreads this particular problem, it's a bacteria, and it's not the same as the one that humans get. Okay, well, if there be no further questions, I'd like to thank you for your time and hope you have a wonderful rest of the week.